News Channel 8 presents New Skills for Living with your host, Tom Lavin, a healthy plan for healthy living.
Hello, I'm Tom Lavin. Welcome to New Skills for Living, a show dedicated to healing and wholeness in our community. If you or a loved one has suffered from depression or anxiety or trauma or a substance abuse issue, you'll want to watch our show today as we have two wonderful guests that will talk with us about the help and the hope of recovery. To my far right is Peggy Kemper, and Peggy is a clinical nurse specialist who has been in practice over 35 years. Almost 20 years she's been at Northern Nevada Adult Mental Health working with the physicians prescribing medications for patients. Peggy, thank you so much for being here.
You're welcome, Tom.
And to my immediate right is Anthony Rodriguez. And Anthony is a consumer in recovery who is very generous in coming to talk with us today. And along with Peggy sharing her professional insights, Anthony will be sharing his personal experience of recovery from addiction and mental illness. Anthony, thank you so much for being here today.
Thank you for asking me.
All right. So Anthony, would you go ahead and talk with us a little bit about your personal story, your kind of like what it was like, what happened, and what it's like today?
Well, I was originally diagnosed with bipolar disorder, schizoaffective disorder, PTSD, and ADHD, which is already a mouthful.
Yeah.
I've worked with 4 different prescribers to get my medication all at a therapeutic level. Before I was diagnosed at Nevada Mental Health, I suffered from all these disorders and self-medicated myself with primarily amphetamines. And of course I was also an alcoholic. Since then, I've worked on my recovery. I've been clean and sober now for 4 years. I've worked with doctors and psychologists, psychiatrists at Nevada Mental Health with subjects such as dialectic behavioral treatment, which shows how to react or respond, rather than to react to situations in life. I've been very fortunate to work with some very professional doctors and nurses at the hospital, and utilizing the whole team treatment program. I've been rather well.
Kind of like supported in your recovery, huh?
Right, exactly.
Yeah,
Thank you.
Okay. And along with like working with the physicians and the nurses, you've also accessed community resources, haven't you?
Oh, yes. I regularly attend the 12-step program of Alcoholics Anonymous. I don't mind sharing that with anybody because I'm here primarily to let other people know that there is help in different facets of society out there. I was regularly attending a particular church that I feel comfortable in, and there are other programs such as NAMI, which is a program for individuals with head trauma, which I also suffered. That also has been a great relief because it's a sort of support program where I can meet other individuals who share in my particular situation.
Yeah, and so Anthony, you've come so far as you've talked with us about all these things that you've done, and you've worked really hard in using medication to help you in therapy and support groups, and actually, hadn't you lost everything or just about everything by the time you came to adult mental health?
Oh yes, I was homeless here in Reno from 2001 to 2003, and it was at that time I saw a lady, a woman from the Washoe County health clinic, and she was the one that said that I should go to Nevada Mental Health because I was exhibiting signs of depression. Yeah. And when I got down there, I interviewed at the clinic, and that's where I found out that I suffered from other problems other than just depression, and that's when I began my treatment at Nevada Mental Health.
And Anthony, that's very generous of you to share your story of recovery and how far you've come from being homeless to how you've really recovered your life, and it's so full and meaningful today. And let me ask Peggy. Peggy, could you kind of comment on some themes of recovery that you heard Anthony sharing, please?
Well, I think it's admirable, first of all, that Anthony chose to come here on your show and share his story. I think that it was very impressive that you've talked about a lot of ways that you can manage your illness by involving yourself with all the programs that this community has to offer, including the 12-step programs, AA groups, dialectical behavioral therapy. Medication is just a small part of what we do in mental health. And I think, Anthony, especially with you started out with having about 5 or 6 different diagnoses. That sounded, oh my heavens, so overwhelming. And yet you've been able to successfully manage yourself in the community, and now you're able to tell how you've been successful at doing that.
Yeah. Well, Peggy, thank you for your comments. And Anthony, again, thank you for sharing your story. And after this brief break, we'll have time to hear a little bit more from Anthony about his personal experience, and then also from Peggy from her professional experience as we take a look at medications and other types of therapy that can help people turn their lives around. We'll join you right after this brief break. Hello and welcome back to New Skills for Living. We're talking with the person in recovery, Anthony Rodriguez, and clinical nurse specialist, Peggy Camper from Adult Mental Health. Peggy, let me ask you, when a consumer comes into your office and let's say they're having problems with depression or anxiety or bipolar disorder, PTSD, how do you decide what medications you're going to prescribe?
Well, Tom, that's kind of a complicated question, and the reason for that is that although one of the things I do is prescribe medication, sometimes when people come in for an evaluation, there may be other choices that we can look at as alternatives to medication. Certainly, one of the things I would consider is how distressed the person is by the symptoms that they're having. That may, if they're having symptoms of depression, I would want to know how much that's interfering with their ability to function. Are they able to get up and get out of bed and go to work? Are they able to have enjoyment in their life? I would want to look at what resources they have available to support them. Do they have family in the community? Are they already involved, like Anthony, in some community groups such as AA? Do they get out and exercise? I look at medical issues. We see a fair number of people at Nevada Mental Health that have very complicated medical problems, and sometimes the medication prescribed for medical illnesses can cause symptoms of depression. Sometimes medical illnesses themselves can cause people to feel depressed when they have nothing to be depressed about. So I'm looking at more than just saying, oh, you're here, here's some drugs. Let me give you some medicine, Tom, because you look like you're really sad and could use that. I'm looking at a lot of other issues before I even pull out the prescription pad and say, this is what we're going to write.
So, Peggy, it sounds like you're looking at the whole person within the context of their life, like physically, mentally, emotionally, spiritually, socially. It sounds to me like you're also talking about things like nutrition and exercise. Are these some of the things that you're looking at with people?
Absolutely. In fact, they have found that people who exercise on a regular basis aren't as depressed as people who sit at home and don't do anything. Just getting up and moving around can be very helpful. You're also getting connected with society when you're out of the house. So yes, we do look at other factors. Nutritional status certainly is important.
Well, I think that's really great to hear a clinical nurse specialist who has the power of the pen and is able to prescribe, Peggy, actually talk about looking at the whole person, and that medication is part of the recovery process for some people, but that there are other things that people can do and that you encourage them to do that. I think that's great to hear. And then, Anthony, now you've had some experience along with the therapies and the 12-step groups. You've been on some medications. Can you tell us a little bit about your experience with that?
Yes. I think that, for one, working with the prescribing physicians there at Nevada Mental Health, I've tried to keep a good hand on what they're prescribing for me and relating to them what the side effects are and how these medications make me feel. They've actually given me a little bit of leeway on how to consume my medications. In some cases, I was told that if, for example, if there was a particular medication that was making me feel anxious or ill at ease, for example, that I might just cut the dose in half myself to work for it. You know that some of these medications take like up to 7 or 8 weeks for a person to get fully acclimated, so that the medications actually work the way they're supposed to work. So I've been told that with keeping up with my physicians and excuse me, I was about to say working with the team treatment program, because it's all a team treatment, it's all a team program. They're with the doctors and the counselors and the psychologists and the psychiatrists. You have to take advantage of all of them together in order for a particular treatment or a treatment plan to work.
That's a really good point, Anthony. And I think in wrapping up today, for this segment, one of the things I want to mention, it is so good for me to hear anyway, and I hope you feel the same way, to hear Peggy talk about having this holistic approach and treating the person as a human being in context with their family and society. And then Anthony, to hear you talk about what we talk about in terms of autonomy, that you're actively involved with your doctors and with the treatment team. That is so good to hear from both of you. And after this brief break, we're going to continue to take a look at how adult mental health helps people and supports people in their recovery. Hello and welcome back to New Skills for Living. We're talking with Peggy Kemper from Adult Mental Health and Anthony Rodriguez, a person in recovery. And Peggy, during the break, we were talking about how, doctors and nurses and institutions and medications can be really scary. Can you talk with us about how you make it less scary and how you help people?
Well, Tom, one of the things that we do over at Nevada Mental Health is we have a pretty informal setting. We have a very good group of people. We're a very friendly group. But I think what happens is when people think about mental health, what first comes to mind is all those scary movies they saw when they were kids, and people being over-medicated or drugged or terrible kinds of treatments happening to them. And mental health is really not like that at all. And I think that we try to educate people when they come to the mental health clinic that we really are there to help them meet the needs that they're having. Medication, like I said earlier, is not necessarily the first thing I'm offering somebody. I want to know what's going on with them, how distressed are they by what's going on with them, what kind of hope factors do they have, is there, what keeps them going. I've even said to people, my heavens, what I've heard, for example, with Anthony, what I heard you say, a lot of people would have said, that's it, I'm done, I give up, I quit, and yet you kept going. You had some hope factors, and we help people try to identify what those are.
Yeah, that's really great to hear you talk about that. And Anthony, can you kind of maybe share your experience, like with asking for help and dealing with stigma and being involved with your treatment team?
Well, personally, I think that asking for help is just the first step. You got to understand that you have a problem, but it's not It's not a debilitating problem. It's something that can be handled. It's something that can be worked with. Mm-hmm. But you have to learn to give the treatment program a chance to work. Just understanding medications, knowing what a particular medication is supposed to do, and allowing it to work for you. I would say in the beginning, when I first started to research what some of my medications were for, I actually was taking my medication and using what I called then positive thinking, that this medication is supposed to do this for me, and then allow it even on a psychological level to try and feel what it's doing for me.
That's excellent, Anthony. Now, Peggy, if we kind of go back to maybe a question I was asking you earlier, though. So when you do decide, and the consumer does too, that maybe medication would be one of the right types of therapies to go forward with, how do you and the consumer decide what medications to go with?
Well, I look at a number of factors before actually choosing a medication. A lot of people have the misconception that they're guinea pigs and we're going to experiment with them. And we actually look at what symptoms a person has, how distressed they are by those symptoms, and how dysfunctional they get. Then you look at categories of medication. If a person just has depression, you may treat them with an antidepressant, whereas someone with schizophrenia, you're going to choose a totally different category of medication. You also have, though, to take into effect the safety factors, because some of these medications don't mix well with some of the medications prescribed for medical illnesses. If you have someone who's actively drinking or using street drugs, you might want to be very careful which psychiatric medication you choose, because you don't want to make them have side effects such as having a seizure by choosing a medication that doesn't mix well if you know you have someone who might possibly drink on it. So we're looking at targeting the symptoms. We're looking at medication that's going to mix well with other medications they may also be on. Another thing I look at is, what are the people taking over the counter? Mm-hmm. Are they taking any herbal preparations? For example, St. John's wort doesn't mix very well with the serotonin antidepressant medications because also has serotonin properties. Yeah. So you have to take into consideration what else they're taking that's outside of what we're prescribing.
Mm-hmm. And then do you and the consumer then, Peggy, kind of need to have some patience? You said you don't treat someone like a guinea pig, but sometimes maybe the first medication may not be the right medication. And so do you kind of like work with the consumer to find the right dose and the right type of medication? Could you tell us a little bit about that in this last minute?
Absolutely. What happens is, even though you try to match the symptoms the person has as carefully with what you think is going to be the right medication, sometimes it just isn't. And what I encourage people to do is, if they're feeling after a couple days that they're having intolerable side effects, blinding headaches, or just not feeling well or overly tired, to call. To give us a call. We have a nurse hotline number they can call, and we can look at, do you need to come in immediately, or is this something we can adjust over the phone? But certainly the first medicine we choose may not necessarily be the medicine that's right for the person.
Yeah. Well, that's a really good explanation, Anthony and Peggy. Thank you for that. After this brief break, we're going to return and again explore how there is help and there is hope. Hello and welcome back to New Skills for Living. We're talking with consumer Anthony Rodriguez and clinical nurse specialist Peggy Camper. And Peggy, could you talk with us a little bit about the importance of the family and the community in supporting the person in recovering from mental illness?
I think that the families are extremely important to involve in treatment with people with emotional problems. Sometimes when people do have problems, they're not the first person who notices that. And their family can actually be quite helpful in getting a person who needs treatment, the treatment in a quicker manner and a more efficient manner. Families, however, sometimes feel really left out of the process. They don't feel like they're invited to come into appointments. And at Nevada Mental Health, we always encourage family members, friends. I've even had sponsors come in to appointments with people that they truly care about. There's also a number of organizations in this area, including the Nevada Alliance for the Mentally Ill, that provides both education and support for families. We have peer-to-peer counselors who been there, done that, can be really helpful with helping encourage people that might feel a little frightened or a little reluctant to actually come into the mental health system. So there's lots of options available.
So I'm hearing you say, Peggy, though, that the families can play a critical role in supporting someone, in not being afraid to get help and then following up with the help that's being offered to them.
Research also, Tom, supports that the involvement in the family is critical to a person's successful recovery and can actually facilitate their recovery.
So family members who are watching will want to encourage them to participate. Anthony, what would you say if someone in our audience is watching and they have a mental health issue or a substance abuse issue? What would you say to them, Anthony?
Well, certainly I would say that if you have a substance abuse issue, that you probably know that you need help with that. If you have a problem with mental health issues, if you're depressed or anxious, or you suffer from paranoia, you know, if you have these issues, don't be afraid to get help. Help is out there for everyone that wants to take advantage of it.
Great. So don't be afraid for the person who might be suffering to go ahead and reach out and ask for help. Anthony Rodriguez, Peggy Kemper, thank you so much for coming in and talking with us about help and about hope. We want to thank you for joining us, and please join us again next month when we explore the faces of mental health and how there is help and hope, and that people can get their lives turned around and people can get better. We'll see you next month. Thank you for joining us.